We all know that breastfeeding is usually a pleasurable experience for both mother and the baby. But we often see that most breastfeeding mothers give up breastfeeding or they stop breastfeeding in the first few weeks or months. Reason being sore nipples or damaged nipples, which are seen very commonly. Today I will tell you what causes these sore nipples, how we can prevent the soreness, and what can be done best to manage the sore nipples so that both mother and the baby can benefit from continued breastfeeding. So it's very important for breastfeeding mothers to recognize soreness of the nipples. So to differentiate between the common or typical nipple pain from the problems of the nipple pain which causes the associated breastfeeding issues. So firstly, the typical nipple pain which happens in the early days of breastfeeding is something which doesn't last for more than a week. It starts in the initial days when the baby is trying to latch onto the breast, lasts for less than 30 seconds, and most often there are no associated skin or nipple changes. But whenever there is a problem with the breastfeeding, the woman feels the pain, which is described most often as excruciating pain. They often feel the entire breastfeeding session very painful, due to which they discontinue breastfeeding. Even in between the breastfeeding sessions, the women feel pain. And once the baby is removed off the breast, we can see that the nipple is pinched, sometimes white, cracked, or even bleeding from the nipples. This itself is called the soreness of the nipples. What causes the soreness of the nipples? Most oftenly it is because of the improper latch. This can be due to various reasons. When the mother and the baby during the initial days are getting used to each other, there can be a delay in the latching. Secondly, there can be problems with the baby, like short tongue, often called as tongue tie. When the baby finds it difficult to latch onto the breast can be engorged, nipple conditions like inverted or flat nipples, and otherwise infections, fungal infections called thrush. Now, how do you prevent this? This is very important. So the breastfeeding mothers should recognize the early breastfeeding cues of the baby. So it can be in the form of a yawn, or it can be the turning of the head from here to there, or sticking out the tongue. Do not wait till the last breastfeeding cue, which is most often the baby starts crying loudly. That is when it gives an unpleasant experience for both the mother and the baby. Now you've seen that your nipples are sore. So what do you do now? Firstly, try changing the positions. Try different positions and see what works best for you and the baby. Most often, this itself will help in latching of the baby, and it relieves most of the soreness, and it gives a pleasurable experience for the mother and the baby. Secondly, it is called breastfeeding and not nipple feeding. So make sure that the baby is not pinching on the nipple. Most of the breast, that is complete nipple, and most part of the pigmented portion called as areola should be inside the baby's mouth. So it's breastfeeding, remember, not nipple feeding. Thirdly, what you can do is, in between the breastfeeding sessions, try to air dry the nipples. That is very, very important. Do not wear tight fitting garments. Try to wear loose braziers and clothing so that there is an adequate circulation of the air. For those women who nurse and also use nursing pads, try to change them more frequently, because if they are wet for a longer time, then it invites infection. Also, to prevent the friction from the clothing, you can use hydrogel pads. One more thing is, the freshly expressed breast milk has very good healing properties. Okay, it has antibacterial properties also. So try to rub it around the nipple and the areola. There are also commercially available creams which are lanolin based, quite safe actually. So use those creams with the advice of the lactation consultant. Do not rub them on the nipple or the areola. Try to pat it. Okay, this creates a moisture barrier and helps in the healing of the nipples. For those who use nipple shields, try to use the correct size of the nipples after consulting your lactation consultant. Okay, this will help in solving the problems of inverted or the flat nipples. So the good news here is that most often the breastfeeding issues or the breastfeeding nipples will heal very easily once the problem is identified and resolution is given. So it's very important that you do not discontinue breastfeeding. You and your baby should experience the complete benefits of this breastfeeding session. So please contact our breastfeeding support group for more tips on this.